and welcome to Kevin's Seventh Heaven. Today I'm going to do a non-sponsored advertisement for some people I really believe in that are selling some products that I really believe in. First, if you have somehow escaped knowledge of their existence, I want you to meet John and Hank Green, the Vlog Brothers. John Green is not only a YouTuber, but he's also an author and a podcaster. He's written such books as The Fault in Our Stars, Paper Towns, Looking for Alaska, and The Anthropocene Reviewed. His brother is Hank, a YouTuber as well, an author, an entrepreneur, a science communicator, and a musician. With all those hats that Hank wears, I think it is safe to say his defining characteristic is how many things he has going on all the time. In fact, there is a website that tracks the amount of days since Hank Green has started a new project. This defining characteristic is a much more difficult thing for him these days, since he recently received a cancer diagnosis and has entered into chemotherapy. John and Hank work on many things together, and John is making an effort to take the stuff off of Hank's plate so that Hank can get well. However, John is not as high energy about administrative things as Hank is, so he often will call himself something along the lines of store brand Hank Green. With all that in mind, I thought I would do what I can to help by making this advertisement. It seems like John needs all the help he can get. The most recent product that they have started selling is Sun Basin Soap. Sun Basin is their brand of bar soap, which is manufactured using natural ingredients such as herbs, herbal extracts, clays, and mineral compounds, sustainable palm oil, and recyclable packaging at a small family-run business in Missoula, Montana. They have 5 different variations. First is the Enigma, or unscented soap. It contains saponified oils of sunflower, coconut, sustainable palm and safflower, shea butter, activated charcoal, and rosemary extract. Next there is Navigator, or clean scent, which is sold out at the time of taping this. Its ingredients are saponified oils of sunflower, coconut, sustainable palm and safflower, essential oils of eucalyptus, Japanese peppermint, rosemary, northwest peppermint, shea butter, pumice, bremic powder, menthol, and rosemary extract. Then there is Daydreamer, or warm scent, which has saponified oils of sunflower, coconut, sustainable palm and safflower, essential oils of blood orange, cardamom, nutmeg, clove, cinnamon bark, pink clay, cocoa butter, calendula petals, and rosemary extract. Next we have Forager, or woodsy scent. It contains saponified oils of sunflower, coconut, sustainable palm, and safflower, essential oils of scotch pine, fir needle, cypress, spruce, black pepper, vetiver, ground coffee, shea butter, and rosemary extract. And finally we have Trailblazer, or bright scent, which is also sold out as of this taping. It has saponified oils of sunflower, coconut, sustainable palm and safflower, essential oils of orange, clary sage, tangerine, and litsea, shea butter, mica, annatto seed, and rosemary extract in it. You can do a subscription of 1, 2, 3, or 6 bars in any combination of these varieties at 1, 2, or 3-month intervals. There's also the option of one-time purchases of 12 or 24 packs of your choice of a variation of all of these types and varieties, or just sticking to one type of soap. They also sell branded wood soap savers and hand towels. Before they got into soap, they created the Awesome Coffee Club. They have 3 types of coffee that you can buy a subscription to in 12-ounce bags of either whole or ground coffee. They are the Light Roast Calypso, which is said to have tasting notes of baked apple, chocolate, and brown sugar, Medium Dark Roast Octavia, with notes of dark chocolate and molasses, and Decaf Medium Dark Roast Paradoxa, with notes of cherry and cocoa. Subscriptions for those 3 products are not always open, so be very aware of what you are getting and when you will be able to get it. They do have 2 products available all the time. You can get 5-pound bags of Octavia, either whole or ground, sent to you every 2, 4, or 8 weeks. They also have 24 packs of Octavia K-Cups with fully compostable packaging, also available every 2, 4, or 8 weeks. Finally, we have the service that I have been a subscriber of since at least November 2021, the Awesome Socks Club. It's a subscription sock service that sends 1 pair of socks a month. The socks are whimsically designed every month by a different artist, so you are supporting the arts. They are manufactured by Pacific Manufacturing, which has offices in San Diego, California, and Haining, China, a city which has a reputation for higher quality textiles. Pacific makes sure any workers are treated well by choosing factories that adhere to the BCSI Code of Conduct, have no more than a 5% employee turnover rate, and by regularly touring the factory floors. The socks come in both crew and ankle socks and in 2 sizes, small to medium and medium to large. As of the taping of this video, the Awesome Socks Club is open to new subscriptions for about a week, so be on the lookout for when you can sign up. Finally, they do have a deal where you can get the past 6 months of socks for $60. Now, here are some of the ones that I've gotten. You can tell that they all have a very fun pattern to them, very colorful, very noticeable, and that noticeability is what I love most about them. Because people will go, "Hey Kevin, nice socks," and it gives me an opportunity to talk about why I get these products. And which is probably the question you're asking yourself. Kevin, you're not being paid for this advertisement. Why are you doing it? Well, beyond just caring about John and Hank and wanting to help in any way I can, the main reason is about where all the profits from these 3 companies go. And by profits I mean after manufacturing, shipping, taxes, and paying the administrative team. Neither Hank nor John take anything personally in profit from these endeavors. They all go to Partners in Health, which is an organization that works with people and governments all around the world to determine the problem that they're having in their healthcare systems, what can actually help to solve that problem, and then implementing those solutions. The specific focus of John and Hank is the state of maternal health in Sierra Leone. To better explain why than I ever could, here is John.
Hi, my name's John Green. I write books and also I make YouTube videos with my brother Hank, and over the last decade, the community that built up around those videos has worked on a number of projects with Partners in Health. From Haiti to Peru to Rwanda, we have seen how PIH helps improve healthcare systems in impoverished communities, and today we're asking you to join us in supporting PIH as they work to transform healthcare access in Sierra Leone, which has the highest maternal mortality rate in the world. Around 1 in 17 women in Sierra Leone can expect to die in pregnancy or childbirth. 1 in 17. They die from undiagnosed high blood pressure, and they die from hemorrhaging, which any well-stocked hospital could easily prevent. They die because there is no electricity to keep the lights on during nighttime deliveries, or to keep blood for transfusions refrigerated. Or they die because in many clinics there is no running water, which makes it difficult to prevent infection. They die due to lack of surgical gloves and lack of medications, and they die every single day for want of a safe cesarean section. In Sierra Leone, needing a C-section is a life-threatening emergency for many women. A woman delivering at home or at a local clinic will usually find that there is no ambulance to take her to the hospital, and so her best chance will be a long ride, dying on the back of a motorbike. This is a crisis. It is an emergency, but because it is an emergency that has been unfolding for many years, it doesn't receive much attention. But also, the solution isn't easy. It isn't ambulances or electricity or water or medications. It's ambulances and electricity and water and medications and much more, because the entire system needs to get stronger. And that's what Partners in Health is really good at, working closely with the Sierra Leonean Ministry of of Health, they are crafting a plan to strengthen every facet of the healthcare system, beginning in the Kono district. That means hiring more community health workers who can make house calls to people with high-risk pregnancies or those living with chronic illnesses, and it means strengthening primary care centers so people can receive good basic care. And it also means the creation and support of the Maternal Center of Excellence at Koidu Government Hospital, which will have a NICU and more operating rooms, and will also serve as a teaching hospital to help train the next generation of Sierra Leonean healthcare workers. 96% of Partners in Health Sierra Leone's employees are Sierra Leonean, and I have seen what they've been able to accomplish through their commitment to their patients despite extremely limited resources. Even in clinics without running water or electricity, children are still getting vaccinated, people with tuberculosis and HIV are still receiving treatment, but it's not nearly enough. 10% of kids in Sierra Leone die before they turn 5, and pregnancy continues to be far too often a life-threatening condition. To radically reduce maternal and child mortality in Sierra Leone, we need your support. This is a long-term problem, and it requires a long-term solution. That's why our family has made an ongoing pledge to support this effort, and we're hoping that you will join us. If you can donate $5 a month, or I don't know, $50 or $500 a month, it will really help. PIH is known for their efficiency and their effectiveness, so I hope you'll consider making a donation right now. I'm sure there are donate links all over this page. You can just click one. I'm often asked why Sierra Leone, and to me there are many answers to that question. It is the epicenter of maternal death in the world. The Ministry of Health is committed to making system-wide change, and Partners in Health's deep connections in Kono allow it to facilitate that change. But also, when we imagine the problems of the world's poorest communities as entirely separate from our problems, we make a them of the world's most vulnerable people. And I don't want to do that. Which brings me to my last request. Having asked you for money, I also need to ask you for something else. Your attention. The most valuable commodity of all. Together, over the next several years, we're going to be able to follow the successes and challenges of this project through podcast and photo and video updates from Kono and through interviews with Sierra Leonean healthcare workers. Whether you can donate or not, please know that paying sustained attention to the structural system-wide challenges of poverty really can lead to change, because we only address the injustices we see. Again, I hope you'll consider making a donation to Partners in Health Sierra Leone today. Thank you for being here, and as they say in my hometown, don't forget to be awesome.
In the years since he's made that video, they have blown past their goal, but that has only allowed them to rethink and expand the project. Construction has started on the Maternal Center of Excellence, with 65% of the engineers, architects, and construction workers being female. It is an excellent endeavor that is lowering the mortality rate every day. If you have no need for the items they are selling, but would still like to help, you can donate at pih.org/HankandJohn. Thank you all for listening, buying, and donating. I will have links for everything in the description, or as Hank and John like to say, the doobly-doo. These will include the BCSI Code of Conduct, which will better explain how Pacific Manufacturing keeps up the high standards for their sock manufacturing in China. Anyway, ta-ta for now. Don't forget to be awesome. Love you all.